to Wine Wednesday. Cheers!
Cheers.
Now, neck pain is something common we see in our treatment center. Now, can you think of a success story of someone recently to give us some hope for those having neck pain out there?
You know, that actually makes me think of a client that we had more recently, and she was actually diagnosed with cervical stenosis, which would be the narrowing of the canal, which puts pressure on the nerves. And she really didn't want to have surgery. However, her physician and the neurologist were saying, go ahead, you can try some physical therapy, let's see if it works, but we're pretty sure that you're going to need to have surgery. And thankfully she came here and we were able to alleviate that discomfort, and so she didn't have to have any surgery.
You want me to talk about what we did?
Yes, please.
Sure. What we found was that, so her diagnosis is stenosis, and as Tiffany had explained, it's narrowing of the canals. A lot of people have that. If we looked at radiographic images for people over 40, a lot of us have stenotic changes in our spine. That doesn't mean we're doomed. What we found was that she had a lot of tightness in the muscles that attached her neck to her shoulder girdle and the muscles at the base of her skull. She had a forward head posture. There was a lot of weakness in the muscles that stabilized the shoulder blade that helped with appropriate posture. A lot of weakness in the muscles in the front of the neck that helped to keep the chin down in a more neutral position. So she was fighting weakness and tightness in the muscles in addition to her diagnosis of stenosis. Stenosis was just a diagnosis, but the dysfunctions we found were weakness and immobility. And when we treated those appropriately, she did very well. She was actually considering surgery, didn't want it, so we helped her avoid that, which is what we love to do.
Awesome. Well, thanks guys for helping someone, and maybe the next person can be you. Cheers.
Cheers.